Good afternoon, Mr. and Miss Jenkins. My name is Ethan Bowie. I am a doctor of physical therapy student. I appreciate you guys taking the time to meet with me today. Um, the purpose of today's meeting is to help you safely manage your new prosthesis, and we're going to hopefully learn some skills that are necessary to improve your mobility, your confidence, and independence at home. All right, Mr. Jenkins. I was just doing a little bit of chart review here, and I saw we underwent a right above knee amputation, also known as a transfemoral amputation, about 8 weeks ago due to complications related to diabetes and peripheral vascular disease. Um, Now, correct me if I'm wrong, but I believe you recently had your first prosthesis about 10 days ago. Is that right? Perfect. And you're currently wearing it about 3 to 4 hours per day. And I was also reading that there's a bit of discomfort at the end of your residual limb. And you've also reported increased sweating inside the socket and some concerns about falling. Okay. Um, yeah, these concerns, what you're experiencing is not an isolated incident. These things are not the least common things to happen, and others with your situation and your circumstances as well. Um, Especially, I would say, in the early phases of prosthetic training and getting used to that device. So we'll go over those things today, and we will try to see if we can't address some of your issues. But the main things we'll be going over today are residual limb care, prosthetic safety, some home safety recommendations. We'll look at some exercises to improve your walking and your balance, some functional mobility strategies, and maybe some other recommendations that I have for you. Our goals, with this, with managing the device, really we want to prevent the skin breakdown, reduce swelling, improve strength, improve balance, prevent those falls, increase our walking ability, and help you feel confident using your prosthesis. And you should just know that recovery isn't exactly a linear path. Recovery, a lot of times, is a process that we work toward, we work at, and progress within that, it takes time. It's good to have, it's normal to have good days and challenging days, but the important thing is we stick at it, we keep at it, and we take our wins. All right. So like I mentioned earlier, the first topic we'll be discussing is taking care of that residual limb. So let's just get right into it. Let's start by talking about how to care for your residual limb. Due to your history of diabetes, proper skincare is arguably one of the most important things that you can do, and something that we can pay attention for. So one of the things that we should do is, our daily skin inspections. If you could maybe assess your skin, check your residual limb skin every morning, every evening. Use a mirror to look all the way around it, or ask Miss Jenkins for help if you need. And really, what we're looking for here are any like redness, blisters. Are there any areas that are open? Is there excessive swelling? Maybe unusual warmth or any other skin discoloration. Now, I do think it's worth mentioning that a small amount of redness after removing the prosthesis can be normal, but the redness, it shouldn't last more than maybe 30 minutes. If there's redness that lasts longer than that, then it may indicate excessive pressure from your socket. So if you do have that excessive pressure, it might be a good idea to contact your prosthetist to try and get that solved. And another thing on the topic of taking care of that residual limb, hygiene is a big one. So ideally what we want to see is you washing your residual limb daily. We would like to see warm water, preferably some mild unscented soap. We really want to avoid the harsh soap, or maybe perfumed lotions or alcohol-based skin products that can cause a little bit of irritation possibly on that residual limb. Also, we want to dry the limb thoroughly before putting on the prosthesis, just because moisture trapped in the socket can also cause a bit of skin irritation and breakdown. So on the topic of the swelling that you're experiencing, I believe it was noted that you had just a mild edema, I guess more towards the end of your residual limb, and also a bulbous shaped residual limb, which means it's almost like a pear-shaped. So that can really, honestly, it could really affect how that limb fits in the socket. So to help control this, what we want to do is make sure we're wearing our shrinker as instructed. That's really going to help shape that limb. We're going to want to elevate the limb appropriately, make sure we're following all of our prosthetist recommendations, and make sure we're performing our exercises to help manage that swelling properly. Residual limb shaping is just, I can't stress enough, is very important, because a properly shaped limb improves the fit and comfort. So I also wanted to go over our sock management. Using that prosthetic sock will help manage the changes in your limb volume. Sock thickness is where it's measured in ply. Commonly we see like a 1 ply, 3 ply, 5 ply, indicating just the difference in thickness. And really, those are important because the swelling of your limb, it's going to change throughout the day. So throughout the day, you may need to adjust your sock ply. And we're really looking at adding socks when the socket feels loose. Maybe when you feel like your limb sinks too far into the socket, or maybe you feel like there's increased pressure. So that's when we would add socks. Ideally, we would remove socks if the socket feels too tight, or let's say maybe you're having difficulty sitting down fully, or you feel like there's maybe excessive pressure at the top of the socket too. So yeah, it's a good idea to keep extra socks with you throughout the day. I think I want to, we'll just go over how to apply one here. So, we have it rolled out. It's going to look a little different. I'm using a regular sock. But what we do is we put that limb in there first, and then everything else will just kind of roll up. So, limb in first, and then roll it up over. Alright, so we discussed the signs of skin breakdown a bit earlier when we were talking about skin inspection. But I think it's also very important for us to discuss signs of infection as well. So if you notice any of these, it might be a good idea to reach out to your healthcare provider. And these things would include if you're feeling feverish, if there's excessive drainage, maybe a foul odor we're smelling, or increased redness, increased warmth, or maybe open wounds can lead to infection as well. And it's just really important to stay on top of this, because especially with our history of diabetes, that can affect the healing. So the earlier we find that out, or we notice the signs of infection and address it, the better. All right, Mr. Jenkins. The next kind of topic I want to discuss with you is prosthetic safety. So I have it in my my notes here. I can see that you're currently using an ischial containment socket. with suction suspension. You have a microprocessor knee and a energy storing foot. These are very good, I would say, advanced components. These are going to be really good for improving your comfort, stability, and efficiency. And that ischial containment socket that's really good for improving control and stability. And it'll contain that your pelvis and upper thigh a bit more effectively. Um, so let's look at donning the prosthesis. So before you put on your prosthesis, you should probably do I these fi- I mean these main things here. You should inspect your skin, make sure your skin looks normal, ensure your liner is clean, ensure the socket is clean as well, um, and then you should check the sock ply that you're going to put on, and then you want to confirm that your valve and suspension system are functioning properly. So since we have a suction suspension system, something that we really want to make sure, that seal is intact. Um, we want to make sure there's no trapped air in there, and we want to confirm that there's a secure suspension before walking. If it's not secure, a broken seal can allow actually that prosthesis to loosen or come off. Okay, now on the topic of maybe what a wear schedule would look like for our prosthesis. Because this is a pretty new thing for you, we don't want to just go gung-ho on it and wear it, as much as we can. We want to gradually increase that wear time, and it should look like a progression. So maybe week 1 we're wearing it 3 or 4 hours per day. Week 2 is maybe 4 to 5. Week 3 is maybe 7 to 8 hours per day. It'll look like a progression, but the main thing with wearing it, of course, is just make sure we're performing skin checks after removal before putting it on. But I would like to mention, there are some situations where we don't want to wear our prosthesis. So let's say some open wounds develop. It's probably not a situation where we want to continue using it at the risk of worsening that wound. If there's skin breakdown occurring, there's significant swelling, or there's excessive pain, or if you suspect an infection, we probably shouldn't be wearing that prosthesis. So, on the topic of fall prevention, I remember it was stated that you, Mr. Jenkins, are afraid of falling, and I just want to let you know that fear is not uncommon. It's actually pretty common. But there are some techniques we can do to reduce your risk of falls. So we want to use our walker as appropriate. We want to make sure we're not rushing. We're taking our time, especially getting used to prosthesis. We want to learn how to use it. Turning, we could do that very slow and incremental steps. Make sure we're using support from our hands when we can. If there are rails, let's use those handrails. Make sure our pathways are clear as well. I'm talking tripping hazards, anything on the floor. Let's try to keep the area void of tripping hazards. And we want to try to wear we could maybe look at some supportive footwear on your sound limb to maybe help with a little bit of stability. Just because we do want to keep in mind that your left leg does have some sensory loss, a little bit of diabetic associated sensory loss, which is also contributing to that increased risk of falls. Now, touching on the maintenance of your prosthesis, I can't reinforce enough. We want to clean the socket daily, and just like the skin, we want to use warm water and mild soap, and we want to make sure to allow it to dry completely before we're using it, and try to make sure we're not leaving it in like a hot car to drive or to dry. I'm sorry, and we make sure we want to keep on inspecting our liners, socks, and suspension components, and make sure we're reporting any unusual noises or component issues to your prosthetists. So the next topic I wanted to discuss with you is home safety. So I just want to make sure I have everything right here. I have down that you live in a one-story home with 3 entrance stairs, 1 railing, and you have throw rugs, a narrow bathroom, a tub shower combination, and no grab bars in the bedroom area. I just there are several modifications that we can do here to improve safety. So my first recommendation for home safety, I think removing the throw rugs would be a very good idea for fall prevention. Throw rugs are one of the most common causes of falls, actually. They just present as a tripping hazard. So I mean, I know we are already a bit fearful of falls. I would strongly recommend removing all loose rugs in the house. Also, I think improving lighting in the house, it would be a good modification for you. That's like installing night lights, making sure we have hallway lighting, adequate bedroom lighting. Just in case we walk at night. If you need to walk to the bathroom at night, it's well lit. You can see, and you'll know where you're going to prevent any unnecessary falls. Also, in your bathroom, I would strongly consider the addition of grab bars, a shower chair, maybe a handheld shower head, or non-slip mats. All those things, just to really reduce your risk of falls. And in the bedroom as well. If you have been having a hard time functionally getting in and out of bed, I think grab bars near the bed, if needed, would be a great idea. And also just making sure we're keeping pathways clear in the bedroom. Try to avoid clutter or, and I'm guilty of this, cords running through. Just be very, very cautious and mindful of that. And now, as far as your assistive devices go, I like what we have at home. So let's keep using the rolling walker for longer distances. I think that's a very good device. And when we're too fatigued to use that rolling walker, I think that's when the wheelchair comes into play, and the wheelchair will be really our friend when we're fatigued. The cane, I think it's a good device, but let's try to use that when it's safe and recommended only. So at this stage in your current recovery process, I think the rolling walker is probably your safest option. And also with stairs, there is a certain way that we want to navigate stairs. So the saying goes, when we're using stairs, it's up with the good. So we're going to go up the stairs with our stronger leg when we're going up, and then we're going to go down with the prosthesis. So we're going to lead with the prosthesis when going down, and making sure we're always using the railing, and try not to carry anything too heavy while we're using the stairs, just for being safe. So I'll say it one more time. It's up with the good, down with the prosthesis, and that's the foot you're putting forward first. All right. The next portion I want to take you through is the good exercises to do in our recovery process. So exercise. It's very, very critical for gaining function without prosthesis. someone, a transfemoral amputee like yourself, you're going to rely on a lot of hip strength, especially our hip extensors, or our butt muscles, and our hip abductors. Weakness in these muscles can contribute to gait deviations and instability, which of course we absolutely do not want when using our prosthesis. So I'll take you through some exercises and I'll demonstrate these for you. All right, so I'll show you some exercises here. We'll start with some exercises laying down. So the first exercise I want to show you is a hip extension stretch. This is going to work those hip extensors that I discussed earlier. So we're going to lay on our stomach, and we're going to raise our leg up like that and hold for 2 seconds and back down. Making sure we're just raising straight up. And we're gonna do that one about 2 to 3 sets for 10 repetitions daily. And then the next one is a side lying hip abduction. So we're gonna lay on our side here, and we're going to simply raise our leg out straight up like that. And that's going to target our abductors here. It's going to be the same thing there, roughly about 2 to 3 sets, 10 reps per day. And then the next laying down exercise, it's more of a stretch to kind of help address that hip flexion contracture. We're going to have our residual limb hanging off, and we're just going to let it hang there and let our hip flexors get a good stretch. And you should really feel it in those hip flexors while it's hanging off, and we'll just let gravity stretch our hip flexors. And the next one I have for you is just some seated marching. So what we'll do here, we'll stay seated like this, and we'll just raise our knees up. So this is going to do a little bit of hip strengthening, but also while we're sitting here raising our knees up, it'll help with strengthening our core actually as well. All right, so next I wanted to do a little bit of balance training. So we could do that. Make sure if we are going to do it, we're going to have some upper extremity support. Okay, so I'll use my trusty table for an example here. And what we're going to do, we'll use support, and we're just going to weight shift. So you'll watch me go side to side. Okay, so weight shift just like that. I want to do that for about 3 minutes per day. That's going to help with our standing tolerance and as well as a balance. So I think lastly with the exercises, I think it's a good idea to have like a regular walking program. So maybe that looks something like we start out walking maybe 5 or 10 minutes, and every 2 or 3 days we'll add 1 to 2 minutes to that duration. And for this, we really want to be careful and monitor, our fatigue levels, making sure we're not getting over fatigued, making sure we're not getting short of breath or any lightheadedness. If we are getting those things, then I would highly suggest ceasing activity. But because of your chronic heart failure, a slow, gradual progression is very important for us when we talk about walking, exercising, and gaining that endurance. Now, the last kind of topic I wanted to go over with you is really functional mobility. So this is really just the movement that we do every day. So I guess, for example, transfers, like for going from a sitting position to a standing position. Some things we want to keep in mind: we want to make sure we're scooted forward and wherever we're seated at, just for proper body mechanics from standing up, get our feet underneath our body, so we could actually use our legs to push up. And we want to push up from the chair with our arms, use those arms to help us. And when we stand, we want to lean forward, and we want to go very slow so not to cause any safety mishaps. And one of the big things that I see, make sure we're not pulling on the walker. I really want to emphasize pushing on the surface that you're on, because if we're pulling on the walker, that walker's not very as stable as if we were to push up from the surface that we're on. Also, for turning, we got to make sure we are taking small steps when we're turning, just so we're not tripping. We're not going, well, I guess, more fast than we're comfortable, just because when we are turning, our balance is reduced, and maybe that's already one of our difficulties. So any ways we can manage that, we'll try to do it as much as we can. Now, as far as gait goes, when we are walking, we want to make sure we're looking ahead, okay? Try to take equal step lengths, and when we are walking, try to have our chest up and stand tall, have good posture. We don't want to have a forward lean when we're walking. There's just there's a lot of I guess you could say deviations that occur in transfemoral amputees, including a lateral trunk lean, circumduction, where we're walking but our leg is coming out here, vaulting, exaggerated lordosis, so maybe too tall, and really what it comes down to is that these deviations often occur, simply because weakness, fear, improper fit, or contracture. Additionally, energy conservation is something we really want to hone in on with this. Because of your heart failure and the increased energy demands of your above-the-knee prosthesis, we want to make sure we are taking our rest breaks, allowing ourselves to catch our breath. We want to make sure we are pacing activities. We're sitting when possible, it kind of comes back to taking advantage of those breaks, and really just avoid rushing. Take our time. And just one of the key things to remember is that walking with a prosthesis does require more energy than normal walking. All right, Mr. and Miss Jenkins, I really appreciate you guys for spending time with me today. I wanted to just reinforce some very important points from what I discussed with you. So like I said, check your skin daily, absolutely. Manage your swelling with your socks very carefully. We want to progress the prosthetic wear very gradually. And the home safety was very important. Please, I urge you, please consider removing those throw rugs for our safety. And continue those strengthening and stretching exercises. I can shoot you an email with the reps and sets that we discussed earlier, and everything listed, just so you have something to remind yourself on. You want to make sure we're using our assistive devices appropriately, especially at this stage. Let's try to prioritize that walker. Especially, we'll focus on making sure we're performing transfers and are turning like we discussed safely. And I also I urge you, please don't be afraid to contact your healthcare team. Any one of us in your healthcare team, if you do notice some skin breakdown, infection, or increasing pain, because it's very important for us to get that early on, like I mentioned earlier. So yeah, like I said, the more that we practice these things, we will develop confidence. I think there's been progression since the surgery even. And continue, we keep at this plan that we have together. I think we will see improvements in our balance, mobility, independence. I mean, you're not gonna be it's not gonna be perfect immediately. It may not even be easy, but as long as we stay true to the plan, I think we'll see progress with consistency and safety. Um, but yeah, Mr. and Mrs. Jenkins, I really appreciate your time, and I wish you success through your journey.